you may have gone through that when somebody is born with sickle cell disease, they don't have very many symptoms for the first 6 months to a year of life because they have fetal hemoglobin in their blood, and that counteracts sickle cell disease. We also know from people with sickle cell disease that if somebody naturally has higher levels of fetal hemoglobin, they tend to have a less severe disease. They don't not have the disease, they just tend to be a little less severe. And then finally, hydroxyurea, which is now a approved, drug therapy for sickle cell disease. One of the major ways it works is to turn up that fetal hemoglobin a little bit. In some people, it turns up a lot and it's really effective. And in other people, it only turns up a little bit and it's not as effective as we'd want. And even the same person who might have been very effective when they were a 12-year-old, it can become less effective when they're a 25 or 30-year-old. So, and it has side effects and it needs to be carefully monitored, and anybody on it should have close relationship with their physician, but it's a very good drug. But the idea is can we use genome editing to replace hydroxyurea, but create that same effect of turning up fetal hemoglobin to counteract the sickle hemoglobin? And that's how Casgevy works.